TB bacteria and become infected, not only from an infected person, but the person also may become infected with tuberculosis by eating or drinking TB-infected product, such as drinking unpasteurized milk from an animal with TB contagious. So a person infected with contagious TB, if it's not treated properly, it can lead to death. Next, we'll move on to definition here. As I have already said in the introduction, that the tuberculosis is a contagious infectious disease caused by Mycobacterium tuberculosis that mainly infect the lungs and can also infect any part of the body. Now we'll see the incidence. Globally, an estimated 10 million people developed TB disease in 2019, and there were an estimated 1.2 million TB deaths among HIV negative people and an additional 208,000 deaths among people living with HIV. In India, about 220,000 TB deaths every year. So in last year, 2020, COVID-19 dislodged TB as the topic infectious disease cause of mortality globally. Next, we'll move on to types of tuberculosis. There are two types of tuberculosis. The first one is active tuberculosis. Here, when the person is infected with active tuberculosis, a person will feel sick and will develop symptoms within a few weeks. Within a few weeks, such as fever, night sweats, weight loss of appetite, etc. As the immune system is weakened and is failed to kill the infection, and it can spread within the lungs and other parts of the body. So people with active TB can spread the infection to others through coughing, sneezing, or talking. Next, we'll see the latent tuberculosis. Here in latent tuberculosis, the infected person will not have any symptoms, but the bacteria will remain in the person's body, as sometimes the immune system cannot kill the bacteria but manages to prevent it spreading in the body. So here the people with latent TB are not infectious to others. Next, we'll see the classification of tuberculosis. Here, the TB cases are classified according to bacteriological confirmed TB and clinically diagnosed TB. Here, in bacteriological confirmed TB is found from whom a biological specimen is positive by smear microscopy or culture. And clinical diagnosed TB case is one who does not fulfill the criteria for bacteriological confirmation, but is not diagnosed with active TB by a doctor who has decided to give the patient a full course of TB treatment. So first we'll see the classification based on the anatomical side of disease. Under these, we'll see the pulmonary tuberculosis. Here, the case of pulmonary tuberculosis refers to any bacteriologically confirmed TB or clinically diagnosed TB, which involves the lung parenchyma. Here, the lung parenchyma means the portion of the lung involved in gas exchange, or the tracheobronchial tree. Here the tracheobronchial tree is composed of the trachea, the bronchi, and the bronchioles that transport air from the environment to the lungs for gas exchange. Next, we'll see the extrapulmonary tuberculosis. Here, in the case of extrapulmonary tuberculosis, it refers to any bacteriological confirmed TB or clinically diagnosed TB which involves organs other than the lungs, such as the pleural lung knobs, abdomen, genitourinary tract, skin, joint, and bones. And in this extrapulmonary tuberculosis, miliary TB is considered as extrapulmonary tuberculosis because there are lesions in the lungs. Next, we'll see the classification based on history of previous TB treatment. First, we'll see the new patients. Here, a TB patient who has never had treatment for TB or has taken anti-TB drugs for less than 1 month is considered as a new case. And next, we'll see the previously treated patients. Here, TB patients have received 1 month or more of the anti-TB drugs in the past. So they are further classified as recurrent TB case. Here, TB patients have previously been treated for TB declared cured or treatment completed and is subsequently focused to be microbiologically confirmed TB case and is considered as a recurrent TB case here. And next is treatment after failure patients. Here, those patients who have previously been treated for tuberculosis and whose treatment fails at the end of their most recent course of treatment is considered as treatment after failure. Next is classification based on drug resistance. First, we'll see the monoresistance. Here, a TB patient whose biologically specimen is resistant to one first-line anti-tuberculosis drug only. And the next one is polydrug resistance. Here, a TB patient whose biological specimen is resistant to more than one first-line anti-TB drugs other than both isoniazid and rifampicin. Next one, we'll see the multi-drug resistance. Here, a TB patient whose biological specimen is resistant to both isoniazid and rifampicin with or without resistance to other first-line drugs. Next, we'll see the extensive drug resistant. Here, a multi-drug resistant TB case whose biological specimen is resistant to any fluoroquinolone, light ofloxacin, levofloxacin, moxifloxacin, and a second-line injectable anti-TB drugs, that is kanamycin, amikacin, and chromomycin. Next, we'll see the classification based on HIV status. Here, first we'll see the HIV positive TB patient. Here, any microbiological confirmed or clinically diagnosed case of TB who has a positive result from HIV testing at the time of TB diagnosis. Next, we'll see the HIV negative TB patient. Here, any microbiologically confirmed or clinically diagnosed case of TB who has a negative result from HIV testing at the time of TB diagnosis. Next, we'll move on to epidemiological factor. Here, under epidemiological factor, there are 3 factors such as agent, host, and environment. Here, we will see the 3 factors one by one. Here, we'll first see the agent factor. Here, tuberculosis is caused by Mycobacterium tuberculosis, and a number of atypical Mycobacterium have been isolated from man, and it is classified into 4 groups that are photochromogen, scotochromogen, non-photochromogen, rapid growers, which the disease are attributed to them and have resembled pulmonary tuberculosis. And here, a person whose sputum is positive for tubercle bacilli and who have either received no treatment or has not been treated fully is considered as a source of infection, infective materials, and infections cases. Next, we will see the host factor. Here in host factor, TB cases all ages. TB affects all ages, and it is more common in male than in female, and it is not a hereditary disease, and it mostly infect malnourished people, and man has no inherited immunity against TB, and it is acquired as a result of natural infection or BCG vaccinations. Now we'll see environmental factor. Here in environmental factor, which includes poor housing, overcrowding, poor quality of life, malnutrition, lack of awareness of causes of illness. All these factors are interrelated and spreading of the disease. Next, we'll see the mode of transmission. Here, here in the mode of transmission, a person who has pulmonary tuberculosis can spread the disease to others. When an infected person coughs, sneezes, talks, etc., they can spread TB bacteria into the air and in the form of tiny droplets. And when these droplets are inhaled by a healthy person, he or she can get infected with TB. So as sputum positive TB patient can infect 10 to 15 persons in a year. Next, we'll see the incubation period. Here in incubation period of tuberculosis, from the time of getting TB infection till the development of positive tuberculin test, it ranges from 3 to 6 weeks, and the incubation period of TB takes weeks or months or years. Next, we'll see the signs and symptoms of tuberculosis. Here in the sign and symptoms of tuberculosis, the patients will have coughing that lasts more than 3 weeks or longer, coughing with blood, that is hemoptysis, chest pain, weight loss, fatigue, fever, night sweat, chills, and loss of appetite. So a person infected with TB will have all these signs and symptoms. Now we'll move on to diagnosis of tuberculosis. First, here we'll see the medical history. Here in medical history, the physician will collect detailed family history and medical history about patient's history of TB, exposure, infections, or disease. After that, he will find out whether the patient has medical conditions such as HIV infections or diabetes. That increases the risk of latent TB infection, which progress to active TB infection. Here next we'll see the physical examination. Here in physical examination, the physician will do thorough physical examination about the patient's overall conditions and other factors such as HIV infection or other illnesses. Next we'll see the chest x-ray. Here in chest x-ray, it is used to detect chest abnormalities, and in this chest x-ray film appears anywhere in these chest x-ray films, lesions may appear anywhere in the lungs and may differ in size and shape, and these abnormalities may diagnose TB. Next we'll see the sputum culture test. Here in this test, it is used to detect TB bacteria that cause an infection. So the results of culture test, positive results may take days to several weeks. It takes 6 to 8 weeks to confirm. Next is sputum smear examination. Here, sputum smear examination is ESIFA specialized smear. Here, this examination is to examine the person's sputum, and this smear examination, it uses Zell-Nielsen acid fast stain to detect acid fast bacteria. Next is CBNEC. Here in this test, this test is used to detect TB and it's resistant to rifampicin. And the results of NET are typically available in 1 to 3 days after a sample is collected. Next, we'll see the interferon gamma release assay. Here, interferon gamma release assay is a blood test used to diagnose latent TB infection by looking at the immune system cells in the blood. And next is biopsy of abnormal glands or other body tissue. Here, a small sample of tissue or fluid is taken from the affected area and used to test for TB bacteria. Next, we'll see the tuberculin skin test. Here, tuberculin skin test is also known as Mantoux test. So, this test is used to test for Mycobacterium TB infection, and besides, these tests are required to confirm TB disease. And this test is performed by injecting 0.1 ml of tuberculin purified protein derivative into the inner surface of the forearm. The skin test reaction should be read between 48 hours and 72 hours. So here we will see the results of Mantoux test Mantoux test reaction according to the size of induration. So if the size of induration is at least 5 millimeters, is considered positive. Is considered positive if the patients have infected with HIV positive, or if the patients have recent contact with someone with TB, or if the patients have had an organ transplant, or if the patients have taken immunosuppressant medications, or if the patients have previously had TB. And next, if the size of induration is at least 10 or more millimeters, is considered as positive. If the person recently immigrated from a country with a high incidence of TB, or if the person have used injected drugs, or if the persons work in a hospital, medical laboratory, or other high risk settings, or if the persons with the following medical conditions that increase the risk of TB, such as diabetes, chronic kidney disease, gastrectomy. And next, consider if the size of induration is at least 15 millimeters or more, is considered as positive. If any persons, here including persons with no risk factors for tuberculosis. However, targeted skin testing programs should only be conducted among high-risk groups. Next, we'll see the diagnostic algorithm for tuberculosis, pulmonary tuberculosis. Now we will see the indication of CPNET.